There is a small orange box sitting in your baking cabinet right now, the same one you used for a batch of cookies last month and probably forgot about since. Most people only think of it as a baking ingredient and nothing more. But that box of baking soda has quietly replaced entire shelves of pharmacy products in households for generations, and almost nobody alive today realizes just how many. The pharmacy aisle has built dozens of separate little bottles, tubes, and powders around problems your grandmother solved with one orange box under the sink. They do not want you adding up how much you have spent on separate products that all do roughly the same basic job as one cheap ingredient. Today we are counting down 15 baking soda health hacks that replace about $40 worth of pharmacy products. And number one is the one that could replace an entire drawer of anti-itch creams with something that costs almost nothing. Let's get into it. Number 15, underarm deodorant. A fresh stick of deodorant was never a guaranteed monthly purchase in your grandmother's bathroom. Pat a small amount of baking soda under each arm with a damp washcloth, or mix it with a little water to form a thin paste and let it dry before dressing. Baking soda helps neutralize the acidic compounds that bacteria produce on the skin, which is part of what creates body odor in the first place. Name brand deodorant sticks cost $5 to $8 and run out within a month or two. She called it her morning dust, and one box lasted her for months. Number 14, teeth whitening boost. A trip to the dentist for a whitening treatment was never your grandmother's first move for slightly dull teeth. Mix a small pinch of baking soda into your regular toothpaste once or twice a week and brush as normal. The same mild abrasive quality found in many baking soda-based toothpastes sold at the store can help gently lift surface stains over time. Specialty whitening toothpaste costs $7 to $10 a tube for the same basic ingredient already sitting in your cabinet. Our grandmothers understood that a small pinch could do what an entire specialty tube was charging extra for. Number 13, tired, smelly foot soak. Tired, achy feet at the end of a long day were never a reason for your grandmother to buy a specialty foot soak product. Dissolve 2 tablespoons of baking soda into a basin of warm water and soak your feet for 15 to 20 minutes. The mild alkaline water helps soften rough skin and can reduce some of the bacteria responsible for foot odor. Specialty foot soak products cost $10 to $15 a bag. She kept a basin by the back door for after a long day working outside. Number 12, athlete's foot powder. A persistent case of athlete's foot was never something your grandmother only treated with a pricey antifungal spray. Dust a small amount of dry baking soda between the toes and over the soles of clean, dry feet before putting on socks. The alkaline environment may help create conditions that are less comfortable for some fungus to thrive in, though stubborn or worsening infections should be seen by a doctor. Antifungal foot powders cost $8 to $12 a bottle. Before specialty antifungal powders existed, your grandmother had already found her own simple step. Number 11, splinter draw out soak. A stubborn splinter buried just under the skin was never an automatic trip to find tweezers and a magnifying glass. Soak the affected area in a mixture of warm water and a few tablespoons of baking soda for 10 to 15 minutes. Many people have found that the skin softens enough during the soak for the splinter to work its way closer to the surface, making it easier to remove safely. Specialty splinter removal kits cost $6 to $9. She called it her soak and pull method, and she rarely needed anything sharper than a clean pair of tweezers afterward. Number 10, denture cleaner soak. An expensive denture cleaning tablet was never a nightly necessity in your grandmother's bathroom. Dissolve a tablespoon of baking soda into a glass of warm water and soak dentures in the solution overnight, rinsing thoroughly before wearing them again. The mild alkaline solution helps loosen buildup and can leave dentures feeling fresher in the morning. Denture cleaning tablets cost $8 to $12 for a 1-month supply. Our grandparents understood that the same box used for baking could care for a denture overnight just as well. Number 9, mouth ulcer and canker sore rinse. A painful canker sore was never something your grandmother treated with an expensive medicated gel. Mix half a teaspoon of baking soda into a half cup of warm water and swish it gently around the mouth for 30 seconds before spitting it out, repeating a few times a day. The mild alkaline rinse can help soothe irritation and create a less hospitable environment for some of the bacteria around the sore. Medicated canker sore gels cost $6 to $9 a small tube. She called it her sore mouth rinse, and she reached for it the moment a sore appeared. Before we get to the top 8, if you are finding these forgotten remedies useful, hit subscribe right now. I post forgotten home remedies and money-saving household secrets that your grandmother used before every little problem came with a pharmacy aisle price tag attached. Most people watching this right now have not subscribed yet. Change that so you do not miss what is coming. Back to the list. Number 8, sunburn soothing bath. A mild sunburn after a long afternoon outside was never an automatic trip to the pharmacy for an expensive after-sun lotion. Add a half cup of baking soda to a lukewarm bath and soak for 15 minutes, avoiding any broken or blistered skin entirely. The mild alkaline water may help calm surface irritation for some people, though severe burns or blistering should always be seen by a doctor. After-sun lotions cost $8 to $12 a bottle. She kept her remedies simple and never paid pharmacy prices for a sunny afternoon. Number 7, heat rash and prickly heat powder. An uncomfortable heat rash in the middle of summer was never something your grandmother let linger for days. Dust a small amount of dry baking soda over clean, dry skin in areas prone to heat rash, particularly in skin folds where moisture tends to collect. The dry powder helps absorb excess moisture, which is part of what aggravates heat rash in warm, humid weather. Specialty heat rash powders cost $6 to $9 a bottle. Our grandmothers understood that a dry, dusted powder could solve the same problem a specialty bottle was charging extra for. Number 6, razor bump and ingrown hair soothing rinse. Red, irritated skin after shaving was never something your grandmother treated with a fancy aftershave balm. Mix a small amount of baking soda into water to form a thin paste. Apply it gently to irritated areas after shaving, then rinse off after a few minutes. The mild alkaline paste may help calm some of the surface inflammation that comes with razor bumps and ingrown hairs. Specialty razor bump treatments cost $8 to $12 a bottle. She did not need a specialty balm to calm freshly shaved skin. Number 5, nail fungus soak. A stubborn case of nail fungus was never something your grandmother only addressed with an expensive antifungal lacquer. Soak the affected nail in a mixture of warm water and a few tablespoons of baking soda for 15 minutes a few times a week. The alkaline environment may make conditions somewhat less favorable for fungus, though the evidence behind this specific use is limited, and persistent or worsening nail fungus should be evaluated by a doctor. Antifungal nail treatments cost $15 to $25 a small bottle. Our grandparents understood that patience with a simple soak was worth trying before reaching for an expensive lacquer. Number 4, bad breath mouth rinse. Bad breath after a meal full of garlic or onion was never something your grandmother covered up with an expensive breath spray. Dissolve a small amount of baking soda in water and swish it around the mouth for 30 seconds before spitting it out and rinsing with plain water. The alkaline rinse helps neutralize some of the odor-causing acids left behind on the tongue and teeth. Breath-freshening sprays and mints cost $5 to $7 for a small tin. She called it her quick rinse, and it worked before any dinner guest noticed a thing. Number 3, body odor bath soak. A full body odor problem after a hot, sweaty day was never something your grandmother solved with a fragrance-heavy body wash alone. Add a half cup of baking soda to a warm bath and soak for 15 to 20 minutes, rinsing off afterward with plain water. The alkaline bath water helps neutralize odor, causing acids across the entire body rather than just under the arms. Detoxifying bath soak products marketed for similar purposes cost $15 to $25 a bag. She kept a box by the tub for the hottest days of summer. Number 2, itchy, irritated skin bath soak. Itchy, irritated skin from a mild rash or general dryness was never something your grandmother scratched through for days at a time. Add a half cup to a full cup of baking soda to a lukewarm bath and soak for 15 to 20 minutes, patting the skin dry afterward instead of rubbing. The alkaline water can help calm surface irritation and ease the urge to scratch for many people, though any diagnosed skin condition is always worth discussing with a doctor. Specialty soothing bath products cost $12 to $20 a bag. Our grandmothers understood that a calm bath could quiet an itch just as well as a specialty product could. And here is number one. Everything on this list so far has solved one specific little problem: a sore here, an odor there. This last one is different because it is the reason this box has quietly replaced an entire drawer of pharmacy products in households for generations. Bug bites, bee stings, and the maddening itch of poison ivy push people toward a whole shelf of separate products: an anti-itch cream here, a hydrocortisone tube there, a bite relief pen, a calamine lotion, each one costing $6 to $12 on its own, which adds up to close to $40 or more if you are stocked for a full summer season. Your grandmother had a single answer for nearly all of it sitting in that same orange box. Mix a small amount of baking soda with just enough water to form a thick paste, then apply it directly to the bite, sting, or itchy patch and let it dry before brushing it off or rinsing gently. The alkaline paste helps neutralize some of the acidic compounds that insect venom and certain plant oils trigger in the skin, which is a meaningful part of why the area itches and stings in the first place. This is the same basic relief that several of those separate pharmacy products are individually priced to deliver, all from one ingredient already sitting in your cabinet. One important note before you try this: a baking soda paste is meant for ordinary mild bug bites, stings, and itchy skin only. If anyone shows signs of a serious allergic reaction after a bee or insect sting, such as difficulty breathing, swelling of the face or throat, dizziness, or a widespread rash, that is a medical emergency, and it calls for emergency medical help immediately rather than any home remedy. For the ordinary itch and sting that most of us deal with all summer long, though, think about what this means. An entire shelf of pharmacy products is built around neutralizing the same basic irritation your grandmother handled with a spoonful from the baking cabinet. They do not advertise how simple the underlying fix really is, because a brightly labeled tube sounds far more convincing than a paste mixed at the kitchen sink. Your grandmother never needed 4 different tubes to get through a summer outdoors. She had one box, she used it everywhere it made sense, and she never paid a markup for the secret. 15 hacks, 1 orange box of baking soda, about $40 in pharmacy products replaced, and a wisdom that never needed a marketing budget to prove itself. Which one of these are you going to try first? Drop it in the comments right now because I read every single one. And if your grandmother used baking soda for something I did not cover in this video, share it. This community holds knowledge that cannot be found in any book, and every tip shared here keeps something alive that deserves to be remembered.